We have Berta with us today, this evening. Berta is 58 years old. She's been a patient of mine for almost 10 years and has been on testosterone replacement a couple of times. We'll just mention that we started in March of 2002 and she responded, except that the dosage at that time was too high and she had an excessive response. So she was off it then for 5 years. Started again in August of 2005, and then we both decided to stop it because her blood level was too high. And then we got the right dose starting in March of 2006, which is a small dose compared to the beginning, and then things took off from there. So let's go back in time and tell us what you were like before you had any testosterone at all.
Okay, before I had any testosterone at all, I was extremely irritable, very depressed, and my sexual desire was like zero. I had no desire for intimacy.
How long had that been going on?
That had been going on quite a while, and I really feel at some point that I was somewhat in denial. I just didn't understand what was going on with me, and I contributed a lot of this to, I said, well, maybe it's just all part of menopause, pre-menopause that I was going through.
Well, by quite a while. Do you mean a couple of years or 10 years or how long?
A long time.
Long time.
A long time.
Depressed, irritable, fatigued, poor libido. You also, before we were discussing this, you used the word timid. You think you were timid?
Yeah, it was to a point where I actually had fear of having any type of intimacy in my relationship, and it's a relationship that I've been in an extremely long time.
Yeah.
And I just didn't understand what was going on with me.
You also used the term that you had a horrible temperament?
Yes, extremely horrible temperament. I mean, I could wake up in the morning and I was like growling, you know. The least little thing someone would say, it would just set me off. I just read into every little thing someone said.
And again, this had been going on for quite a while.
Yes.
Okay, so then we started you on a good dose of testosterone in March of 2006, which is almost 3 years ago. And what's happened?
Well, gradually I started seeing changes. My temperament started improving. Things that would upset me no longer upset me the same way. I had like control over the situation. I was able to think things out more rationally. And the depression started going away. I actually started to like myself again.
Almost everybody who narrates their story tells about an increase in the self-confidence and an increase in self-esteem.
Yes, and that's
very
something,
common phenomenon.
Yes, that's something I always had. And I just couldn't understand. It was just disappearing. I'm saying, what's going on with my life? You know, I just didn't know where to turn. I didn't know what to do.
What about the sexual part of it?
The sexual part of it, the desire started coming back. I mean, even to the point that I found myself going back to Victoria's Secret and, you know, just doing little things to just jazzy up the relationship.
You had also said something about that the way people react to you or respond to you is different than before.
Wow, it blows my mind. It's like when I see people, they greet me, good morning, how you doing, have a nice day. And something that really had me taken aback was this gentleman that I know. He said to me one evening, he says, what are you doing different with your skin? Your skin looks so different. I says, what are you talking about? He says, your skin looks so youthful. I said, well, what are you trying to say? I'm old? He laughed. He says, no. He says, but your skin really looks great. And I said, thank you. You know, and I thought about it. I says, whoa, I didn't change any products or anything, you know, that I was using. I can only contribute to the testosterone.
Yes, that is a very, very common effect. People start to look younger and their skin looks younger. The whole body gets younger.
Yeah.
It's a wonderful thing.
Yes.
Okay, well, I thank you very much for your story. I'm sure people are going to find it very interesting and helpful, and we're going to try to get everybody to become like you.
All right. Thank you, Dr. Gordon.
Thank you.
Okay.